Our healthcare system is broken. I encounter evidence of this on a daily basis in my practice. One of my patients allowed me to share his story with you, and I want to go through that as an illustration of how badly broken this is. Jason is a real estate agent who is married with 2 children. He has his own business. The Affordable Care Act promised to make things better for him, and he was really looking forward to that happening because his costs were high. He applied for a subsidy through one of the programs, and he did receive a subsidy. He got $1.28 per month, $22 a year. Now, his health care costs in 2015 were $23,000. So that $22 per month offset things a little bit. But one of the things he didn't realize when he signed up is that he had 2 children, and he was required to buy dental insurance for those 2 children, and he failed to do so. So the IRS, recognizing that they had given him $22, fined him $1,900. Needless to say, he was not happy. So in 2016, things got better. He received, he this time bought dental insurance. He got his premium for that, and it was $1,395 per month, or $16,740 a year. But his deductible went up, his copays went up, and as a consequence of that, his out-of-pocket expense in 2016 was now $39,000. And he didn't qualify for any subsidies because his income had gone up. So he got through that. By the way, he decided to use that dental insurance because he had it. Didn't realize that it didn't cover everything. So as he used his dental insurance, what he discovered was that he had another $11,000 in uncovered expenses that his children had acquired. But at least he didn't get fined that year from the IRS. So the next year, in 2017, he gets his premiums that came through, and this was a shocker to him, as well as I believe to probably everyone who's purchasing health insurance. His insurance premium went up to $3,250 per month, or $39,000 just for his premium. So he's now paying in premium expenses for 2017 what he paid for all of his health care in 2016. And you'd think he'd have a really good policy. He has a $5,200 deductible per person with a $13,000 max for family if he stays in network. If he goes out of network, it's a $25,000 deductible per person with no maximum for the family. He is estimating that his costs in 2017 will be $65,000 because even after he's met that deductible, the insurance policy only pays 80% of his charges. He's still responsible for 20%. Clearly, this isn't working. And this isn't working for a lot of people. So how did we get here? What happened? I believe the reason this happened, especially with the Affordable Care Act, is that our politicians tried to create a solution to a problem without first understanding what the cause of the problem was. In my experience, that never, ever works. So what's the cause of the problem? Ladies and gentlemen, I'm going to introduce evidence to you that I believe will demonstrate beyond any reasonable doubt that the cause of the problem is the focus on healthcare delivery to the exclusion of every other cost involved in healthcare. And we've been doing that now for 40 years. So, with you as a jury on this, we're going to go to exhibit number 1. This is a chart of healthcare costs worldwide. And what you can see here is that the United States was pretty much at the leading edge through the 60s and into the 70s, and actually even into the 80s. Our healthcare costs were beginning to rise consequent to Medicare and Medicaid being introduced in 1966, and a whole population of people that began to access care that hadn't accessed it before. The federal government began to act as an insurer as a consequence of this, and as the federal government began to act as an insurer, it began to have an interest in cutting those costs down. So it began looking for ways to do it. And I'm not going to go through what happened in the 60s and 70s because it would take way too much time. But around 1980, the insurance industry came to the government and said, you know what? The problem is that the health industry lacks management. If we imposed disciplined management techniques within the health industry, we would have a more efficient delivery of health care and costs would come down. And our government said, great, let's do it. And hence the managed care model came into play. And that came into play right around 1980. And you can see in 1980, we begin to separate from the rest of this. Costs began to rise as this model got implemented. The insurers basically set up networks of physicians, set up discounted relationships with those physicians within the network, and costs continued to rise. Ronald Reagan came along in 1986 and said, well, let's try fee schedules. Let's tell the physicians what they can charge, and that should contain cost. So in 1986, right around in here, the fee schedules got imposed. The private insurers said, that's a great idea, we're going to do the same thing. And so they imposed fee schedules of their own within their networks, and costs continued to rise. They said, well, we're not managing it more aggressively enough. What we need to do is we need to pre-authorize surgeries. And then we need to pre-authorize diagnostic tests. So CTs and MRI scans need authorization. And then we should pre-authorize the treatments that we have. So physical therapy needs pre-authorization. And then we need to get pre-approval for pharmaceuticals because those cost money too. And then we should try some techniques like pay for performance and accountable care organizations. And with each successive effort to decrease costs continued to rise and separate from the rest of the world. So why? Why did all of these measures that were designed to contain cost actually fail and possibly serve to increase the cost of healthcare in our country? The answer to that lies in the next slide. We're paying attention to the wrong thing. This is a graph of the number of physicians in the United States between 1970 and 2009. The number of physicians in the country increased about 125%. The population of the country increased 125%. The number of administrators in healthcare increased over 3,000%. And as you can see, the steepest part of this curve is right when all of the managed care policies began to come into existence. So there is a clear correlation between the number of healthcare administrators and the cost of our healthcare. So what are we doing to solve this problem? Now that we know that this is the problem and not the healthcare delivery down here, what are we doing to solve it? More of this. Every technique, every program that I've heard of, every leader that has come out to talk about healthcare reform in the United States is talking about more management of healthcare delivery. We're doing it through electronic medical records. We're doing it through population management to get people to behave better and become healthier. all the types of things that we're going to do, but we're not addressing any of this. In fact, every time we come up with a new policy to manage our healthcare, we create more administrators. United Health Group launched 3 years ago a new division called Optum. Optum is a pure managed care play. It has 3 components. There's an analytics component where they do nothing but gather data. There is a healthcare management component where they help hospitals and practices manage the healthcare delivery. And then there's a pharmacy benefit management component. Optum took in $67.7 billion in revenue in 2015 alone. Now that's not from healthcare delivery. They didn't deliver any healthcare. That's money that we're paying in our insurance premiums. And this is a reason why our insurance premiums are becoming unaffordable. There is no way that we can possibly make the system work if we don't stop managing healthcare delivery. So what I propose is an entirely different model. What I'm proposing we do is we create a new paradigm in which we replace the management of healthcare delivery with the management of healthcare finance. What we need to do is create the funds to exceed the need rather than forcing the need to fit within a predetermined set of funds. And this can be done by allowing each and every company within our nation to establish its own endowment for healthcare. There's an easy way to do this. Companies that have 5,000 or more employees already self-fund. The reason they do it is because it's 30% cheaper. So, but those companies don't have the ability to retain funds to create an endowment. What I'm proposing we do is change that model, that we allow a company to not only put funds into their health benefit account, but retain funds in there if they're not used, and do so untaxed. A company retaining 30% every year untaxed is going to, in 15 years, create an account which becomes self-sustaining. For a company with 100 employees, that means you're going to be looking at about $13 million per 100 employees. Now, once you get to that point, the revenue from investment on that income can replace the employer's contribution. The employer never has to fund healthcare again. All that money can go into growing his business, marketing for his business, or hiring new employees, or even better, paying those employees higher wages, which we could definitely use in this country. Yes. And this provides a solution to that problem. The only impediment to that is, oddly enough, the IRS. Who would have thought? The Internal Revenue Service, under Section 419 of the IRS Code, has a provision for taxation of any funds that are retained in an employer's health benefit account that aren't spent in 13 months. So what I'm proposing we do is modify that section of the IRS Code. Now, since I am the only person proposing this, and since this has never been done anywhere in the world, what I did is I set up a 501c3 educational nonprofit whose purpose is to deliver this message and build a movement to basically force our politicians to pay attention to what we need. If we don't do this, costs are going to continue to rise. What's certainly the government's taking over healthcare is not going to make it more affordable. We already saw that that didn't work. And it didn't work for a whole host of reasons that I don't need to go into. What the Republicans are currently proposing won't change that dynamic that I had up there a little bit ago. It's not going to get rid of any of that administrative cost. Yes, health savings accounts are important, but they need to be coupled with an employer-owned endowment so that the two work together. You can't do it with health savings accounts alone because you'll never get rid of all of that administration that the insurers bring to the table. They don't want it to go away. United Health Group didn't invent an entire division that does nothing but management because it wasn't profitable for them. They want to continue it. So we as a group, we as individuals, need to come together and work on this. So what I'm inviting people to do is go to my website and join the movement. Go there and today make an effort to finally do something that will make healthcare in this country affordable. Let's create a healthcare system that allows us to take the prevention of illness, the treatment of illness, and the recovery from illness, and give it a priority over the cost of treatment. Because we can do that. We live in a capitalist society. We can certainly create the funds to do this. Let's together finally build a healthcare system that is better, not only for ourselves, but for future generations to follow. I want to thank you for your attention. You've been a lovely audience.